Wow, that was a great lunch. Thank you to Marriott staff for preparing that wonderful meal for us. So grateful. Earlier this morning, you heard that Chair Strong was weathered out, but she did make it shortly after we started. So I'd like to introduce Chair Kimberly Strong to join us on the stage for her welcoming remarks.
Thank you, Interim President Singh. Boy, how do you stand up here? Good afternoon, everyone. I appreciate everybody's participation here today. Let me introduce myself. I'm Tlingit, from the Chilkat Indian village of Klukwan in southeast Alaska. I represent the Search Board, the Tribal Health Organization of Search at the ANTHC level. I also am their chairman of the board, and Hesge yuchat duasat Tlingit gainach chachnach hadsati kagwantana yuchat ganach tedi yeti ayachat guchdach hit. My Tlingit name is Hesge, and my grandmother told me it means everybody's auntie, and I don't have children myself, and so I truly have come from a large family, nine brothers and 2 sisters, and so I have probably well over 50 to 100 nieces and nephews to date, and I've had opportunity to help with the rearing of a lot of them, and a lot of them have stayed in my home for a good period of time. I think that this team has been doing a great job today. I think that the work that we heard from the DHE program, I kind of appreciate having come in a little late and being able to hear the presentations and get a firsthand hearing of what the people had to say and what they appreciated or didn't appreciate about the services that we're trying to improve here at ANTHC. As Ms. Singh said, we are very much trying to improve our relationship, improve our abilities to work with the tribal health organizations, to improve that service in our communities. The board has made it a strategic initiative for management to carry out, reach out, improve communication and accountability to our tribal health organizations. It is not an easy thing to do. I think about ourselves, coming from southeast Alaska, you know that we have a lot of tall mountains and a lot of trees. And I think about a story that I've heard from my region about the trees and how they got to the top of the mountain, how they get up those steep cliffs. And I associate myself as a Native person whose roots run deep, and our relationships are interconnected with all of our natives throughout the state of Alaska. And in that interconnection for the roots of a tree, in order for it to climb to the top, it needs the help of the roots of the other trees to improve those great heights, to get up to the top. And that's the way I think about our tribal health organization. We all have our native roots in this land. I gotta say, again, I know President Singh thanked the Dena'ina people for allowing us to be here on their land. Throughout the state of Alaska, this is our land, our people's land. And thank you. And it's our responsibility as stewards of this land and stewards of our health care. We, as a people, said we can do better than Indian Health Services is doing in Alaska. Let us provide our own services. I personally believe that, and if you've heard me speak, I always say, until we get that health care that the President of the United States gets, we are not getting the health care our treaties with the government says we should be getting. And I want to say, I feel that our self-determination and our self-governance tells us we can do better. Deciding to be the governance of our own health means that we're actually not going to just rely on the federal government with the IHS funds that they give us. We have to do better than that for our people. If you're older like I am getting myself now, there was always the stories, if you're going to get sick, then get sick before June, because IHS dollars run out in June. We at ANTHC are trying to position tribal health care to not solely rely on IHS dollars. We have to figure out how we work together to improve that system of health care. At the symposium that President Singh had hosted, was it back in October, Manilik, Tim, I can't remember his last name, Gilbert said, we need to put a capital S on tribal health care system, capital S. And I think that comes from us working together. It comes from everybody pitching in at your tribal health organization. As our board members are here and sitting around the room, these are the people. They need to know what to bring to the table for your tribal health organization. We rely on the directors, health directors at the tribal health organizations to inform our tribal board members, to bring that message to the table, to help set that strategic direction that will give us that opportunity to improve the things that we're very intentionally trying to improve. Is it going to be easy? It isn't. If it was easy, we would have done it a long time ago. But again, this is my plea for everyone to please. We put that in our mission. Oh boy, it's written down here somewhere for me. Basically, it's for our tribal health organizations, working in partnership with our tribal health organizations. And that partnership means both of us coming to the table and working on this. I'm pleading with everyone, if you are not part of the tribal health insurance program, the T-SHIP program, try and convince your tribal health organization to join the tribal health insurance plan, because that's where third-party billing monies come from too. They'll help you get into Medicaid, Medicare. It'll help you get, I think it's Blue Cross insurance. Those dollars will help us improve the health care across the state. Now for what they wanted me to talk about. I think that improvement of healthcare systems is again a partnership with all of you. I do think that we will accomplish this in partnership with all of you. And Ms. Singh said I've done it, and my 3.5 minutes went into 7. So goodness, sheesh. And again, it's good to see all of your faces here. I appreciate your participation and your input in helping us improve the services. Chish, how?
We've learned to just
Patients,
give.
families, and communities are at the heart of everything we do at ANTHC. Every day, our teams work together to meet the unique health needs of the people we serve. To achieve this, we foster collaborative partnerships with tribes and tribal health organizations around the state to provide access to high-quality, comprehensive services. In 2024, we saw the impacts in many areas because of our commitments to this mission, from transformative investments in the hospital and specialty clinics to historic water and sanitation construction projects in rural Alaska and wide-reaching community wellness programs. In August, we were proud to break ground on the $257 million investment ANTHC is making to expand the Emergency Services Department at the Alaska Native Medical Center. When Phase 1 is completed, the department's capacity will nearly double. It will enhance patient flow, reduce wait times, and will help us to better support current and future needs, improving our ability to provide timely, life-saving care. This year, the ANTHC board also approved $69 million in funding to build a short-term skilled nursing facility, and construction is already underway. This two-story building will have a residential feel, providing care for individuals well enough to leave the hospital, but not quite well enough to go home. The facility will be located on the northwest corner of campus and will optimize capacity at the hospital. We celebrated the 25-year anniversary of ANMC's Level 2 Trauma Center designation in 2024. This achievement recognizes our medical team's long-standing dedication to optimal care for adult and pediatric injured patients. ANTHC was selected for the Life Center Northwest Outstanding Hospital Achievement Award this year in honor of our dedication to organ donation and tissue recovery. Improved donation policies and enhanced education practices led to this award. We also hosted ANMC's first honor walk to commemorate the generosity of organ donors. Another area of excellence, the Alaska Native Medical Center was nationally recognized for high-quality stroke care, receiving the American Heart Association's Stroke Silver Plus Quality Achievement Award. Our stroke care teams are committed to ensuring patients receive the best treatment, empowering them to recover and thrive. Climate change is impacting the lives, communities, and the health of Alaska Native and American Indian people. This is why ANTHC is working with communities to address the environmental threats facing our state. Through a historic partnership with the National Oceanic and Atmospheric Administration, ANTHC received a $74.9 million grant. This grant will be used to support climate resilience, study how climate issues impact health outcomes, and expand statewide tribal adaptation resources. Access to clean water and our wellness are deeply connected. ANTHC's construction and engineering teams made life-changing improvements all over the state as the organization continues to support communities and regions in constructing long-overdue water and sewer systems. Another way ANTHC contributed to communities and regions. This year, our Division of Environmental Health and Engineering hired 63 local employees, keeping $452,000 of wages in communities and regions. By investing in local talent, we're strengthening community resilience as we build our infrastructure. One standout achievement in impacting community health was an oral health promotion. Over the past year, we expanded our training offerings for dental health aides to meet the requests of partner tribal health organizations. This included a new training that prepares dental assistants to provide essential cleanings in their communities, improving access to preventative care in rural areas. ANTHC also hosted the Integrated Health Aid Forum, bringing together 250 healthcare professionals from across Alaska. This forum fostered collaboration, learning, and future partnerships. Together, we are building a stronger health aid community, united in commitment to compassionate, culturally appropriate care. Thank you to the patients who let us serve your health needs and our THO partners who collaborate with us in our crucial mission. From expanding access to healthcare to fostering environmental resilience, together, we're making a difference.
What an awesome video. Thank you for that. Good afternoon. Thank you for joining the 2024 ANTHC annual meeting. Again, my name is Natasha Singh, and I serve as ANTHC's interim president and CEO. I am a Stevens Village tribal citizen from Fairbanks. First, thank you to Chair Strong and the ANTHC Board of Directors for your continued efforts. This morning, I shared a little bit about the leadership provided by the board and how we are implementing ANTHC's strategic plan. Now let's get into the details. I'll first begin by introducing some people who are crucial to our efforts in this area. Members of ANTHC's executive team, please stand when you hear your name. Dan Neumeister, Interim Chief Operating Officer. You don't have to cheer that long for everyone. Dwayne Stilson, Executive Vice President and Chief Financial Officer. Dr. Alan Vierling, ANMC Administrator. Tiffany Hild, Vice President of Communications. Monique Martin, Vice President of Intergovernmental Affairs. Allison Reed, Chief Ethics and Compliance Officer. And Robert Lynch, General Counsel. Thank you to everyone for bringing your perspectives, experience, and energy to this important work. ANTHC is a large, complex organization. Right when I was becoming Miss Know-It-All at TCC, I was real humbled when I came to ANTHC, the only statewide tribal health organization in Alaska. ANTHC provides everything from specialty care and inpatient hospital services to telehealth, water and sanitation construction, wellness prevention services, training, and much more. ANTHC is your consortium. Its statewide focus is built into the design of our governance. We represent all Alaska tribes and regional health organizations through representatives on the board of directors. Although the board comes together from various tribes and regions, they are making decisions to benefit the entire state and the greater good of all patients and communities served by the Alaska Tribal Health System. The Alaska Tribal Health System is an affiliation of tribes and tribal health organizations providing health services in Alaska. As a system, we respect another's local decision-making and self-determination to meet unique needs as we coordinate care and services across systems. This kind of collaboration supports a comprehensive continuum of care for patients we all serve and is only possible through strong partnerships that Chair Strong just mentioned. In October, ANTHC was proud to host the Alaska Tribal Health Forum, bringing together hundreds of tribal leaders from across the state. There we discussed issues we face and ideas to move forward together, whether it was related to needs on the Alaska Native Health Campus or ANTHC's strategic plan. Today, we are excited to enhance the annual meeting with greater opportunities for priority setting and feedback. The patients we serve and partners we work with should feel empowered to know where we are, where we're going, and how we'll get there. As we think of systems improvement together, we strengthen and move forward the next chapter of self-governance. As I shared with you this morning, in 2022, the ANTHC Board of Directors adopted the organization's first ever 3-year strategic plan for fiscal years 23 through 25, and a financial plan to put it to work. The plan has 3 leading themes: empower the workforce, focusing on meeting the needs of our employees; enhance the system of care, reinforcing our commitment to improve access to care services, enhancing strategic partnerships; and achieve performance excellence, providing the highest quality of care and service. This plan is aligned with ANTHC's mission to enhance healthcare coordination among tribal partners as we deliver high-quality services that promote health. In FY24, we continued advancing unprecedented change for ANTHC and really any organization. Although change can be difficult, we are striving to meet our ambitious goals. This year, every measure included in the organization's scorecard made progress. 5 measures achieved 80% threshold target, 4 measures achieved the 100% target, and 18 measures achieved the 120% stretch target. That is so significant, and I'm so appreciative of all the team's work into hitting those targets. A lot of hard work there. This is an improvement over last year, in which 6 of our scorecard measures were not met. Some of our successes include a large increase in employee engagement scores. We also saw a 20% increase in the number of employees who took the survey. This is hard to do when we're transforming and implementing change, a lot of accountability on our staff and managers, yet our employee engagement scores improved. Someone who's been here for a while said, it's because we're implementing the plans we always said we would get to. And I think that's right. I think the board has given us clear direction, and we're carrying forward the work. And there's just a pride among the staff that's increasing every day. So it's so awesome to be a part of that transformation. We advanced many patient travel and housing improvements in collaboration with our tribal partners that you heard a lot about earlier this morning. More successes include patients staying at ANMC reported improvement with communication with nurses. We are making progress on our constructing of the emergency services expansion and short-term skilled nursing facility. More on these projects in a moment. More success includes consistent increases in patient volumes, suggest we are increasing access to specialty clinics and surgical care. Finally, we are improving our financial health, which allows us to make investments to meet the needs of the patients today and for generations to come. These kind of improvements, as we continue to provide programs and services, take an incredible amount of focus and discipline. Please join me in recognizing the hard work of our committed teams this past year. Some areas continue to be opportunities for improvement. Like many of our partners, we are working to improve the percent of Native employees, especially in leadership positions. We have strengthened recruitment efforts and career pipelines to support continued development of Alaska Native professionals. We're always looking for good people, so please apply for opportunities at anthc.org/careers if you're interested in joining the team. We have a few openings at this time. We have heard clearly from tribal partners the importance of a robust, thorough electronic health record strategy. While the electronic health record improvement effort began in 2024, it will continue into this next year. More on this in a moment. These images remind us whether we are filling our freezers, are moving forward on an improvement journey, the best outcomes are achieved by working together in the coming year. We're excited to work closely with the ANTHC board as they lead the organization's strategic planning into the next phase. Earlier this year, we celebrated the 30th anniversary of the Alaska Native Health Compact, our legal agreement with the Indian Health Service. Alaska tribes have led the way in transforming rigid federal programs. Our system created unique services and care models that now inspire tribes in other parts of the country and even around the world. Over the summer and early fall, we identified a gap existed with partners and where we are as an organization and how we're moving forward in the next 30 years. To close this gap, the Alaska Tribal Health Forum was implemented. This 3-day in-person event brought together more than 120 tribal leaders representing 29 tribes and tribal health organizations. On any given day, depending on the topic, an additional 30 to 50 attendees joined an online webinar to listen in. This statewide meeting sought to gain alignment on challenges, opportunities, priorities as the tribal health system confronts several issues, including the ANMC hospital ownership and the Shared Electronic Health Record, or EHR. The Alaska Native Medical Center, ANMC, is and always has been a statewide resource. It is the referral hospital for the Alaska Tribal Health System, where all regions and tribes receive services. Built by the federal government in the late 90s, ANMC is still owned by the Indian Health Service. We lack ownership of the hospital we manage, operate, and seek care from. This limits our ability to meet our needs today and for future generations. The next chapter of self-governance includes advocating for ANMC ownership to be transferred to Alaska's 229 tribes who already operate and govern the facility through ANTHC, the only statewide tribal health organization. While we did not get into the detail at the forum, addressing the rising costs of the emergency medical transportation also remains an urgent priority of the ANTHC Board of Directors. As we collaborate with partners to find a longer-term statewide solution, it continues to be our goal at ANTHC to significantly improve our medevac support. The Indian Health Service has scheduled a technical assistance on Tuesday, December 10th at 1 p.m. And we're going to work with the Alaska Native Health Board to schedule a medevac task force meeting shortly after this. I see President Alberta Unak from the Alaska Native Health Board is present here today. Thank you for being here. I heard a cheer for you, Alberta. We recognize the statewide nature of this challenge, this medevac challenge, and how important a solution is for the patients who need these critical services to access care. Finally, as we near the end of our contract term with our electronic health record, or EHR vendor, in 2025, we've heard plainly the importance of taking time to complete a thorough assessment of this tool. This will be the first part of informing what our next steps together should be. We have heard a wide spectrum of perspectives statewide on the ideal solution for an EHR. Individual tribes and tribal organizations have shared diverse needs. In 2025, the ANTHC board will be in a unique position to balance all of these needs, especially with such a technical tool. In alignment with this feedback, ANTHC has slowed down the assessment process. We want to gather needed feedback from tribes and tribal organizations to understand the requirements, gaps, and opportunities, and fully document the pros and cons of the existing system or potential alternatives. As I mentioned earlier this morning, ANTHC is working with impact advisors to complete this EHR assessment. Their teams will be in Anchorage for a full 2 weeks through December 13th, and we're joined by them today. Please stand and raise your hand when I call your name. Is Michael Tothrow from Impact Advisors in the room, or is he outside? He's not standing because he's not in here, but he is in the house, and he can schedule your assessment as you need it. We also have our very own Dr. Brunel and Garrett Spargo with ANTHC, and they're happy to talk to you about this work. If your tribe or tribal organization would like to meet one-on-one to begin the conversation, we have reserved a side room, and that's where Mike from Impact Advisors is. He's probably in a meeting right now. Please participate in this assessment. There is no predetermined outcome, and your feedback will inform the decision we make together regarding our next steps. As Chair Strong was saying, we need to build the capital S system, and participating in the electronic health record assessment is going to help us get to that capital S system. Now let's talk about some important work that's happening to build the facilities that serve patients and families. I'll highlight the emergency services expansion and short-term skilled nursing facility in a moment. We opened new spaces for orthopedics and ophthalmology, and we're working right now to expand cardiology. We are planning and renovating space for the installation of the MedSet robot. This will allow us to increase the number of mail-out prescriptions delivering medications directly to patients. Finally, we have increased housing capacity by converting University Lake Spring Hill Suites to 100% patient housing. Even now, we're managing 420 patient rooms each night, and so we continue to use an average of 100 additional rooms in the community. We're considering opportunities that will close this gap. All these investments align with our long-term goals and reflect our commitment to providing the highest quality of care to patients. The ANTHC board approved a $257 million to launch the emergency services expansion. In August, ANTHC broke ground on the project, kickstarting many visible, tangible aspects of construction. This expansion will begin correcting years of inadequate space and design limitations at our statewide tribal referral hospital. The project has been separated into 2 phases. Phase 1, floors 1 through 3, and Phase 2, floors 4 through 6. Phase 1 increases emergency department space, recovery space, and space for patients requiring observation. It ensures we provide safer care, helping get emergency services patients out of the hallways and into private care areas. We will decrease wait times for emergency care and overall for patients being admitted to the hospital. Importantly, it allows us to receive more patients in transfer from rural Alaska with fewer delays. Phase 2 increases the number of adult inpatient beds to address ongoing capacity constraints. It also includes a helipad to enhance trauma care. This is a big deal because many patients cannot be served during traumatic medical events because we lack access for emergency air transport. While the board evaluates whether phase 2 can pay for itself over time, ANTHC's successful pursuit of hospital ownership ensures we can continue investing in the statewide facilities we need and patients deserve. Critical to the potential success of phase 2, the ANTHC board recently approved the purchase of long lead items like steel. This is relatively low risk, forward-looking, and keeps options open to avoid potential delays once ownership and other related issues are resolved. The board also approved the short-term skilled nursing facility, a $69 million investment. This facility will provide the right level of care for patients, ensuring those who are well enough to leave the hospital but not quite well enough to go home have an appropriate place to continue healing. It will offer nursing, occupational and physical rehabilitation, hospice, and other step-down services, optimizing acute care capacity at the hospital. The 80-bed, two-story facility will be about 92,000 square feet on the northwest end of the campus by the Spring Hill Suite side. This will allow for seamless coordination between hospital care teams and skilled nursing providers. Construction began early this year and work continues. We expect the facility to be complete in the summer of 2026. Other FY24 capital investments includes the Enterprise Resource Planning upgrade. ANTHC has been challenged by highly manual systems that support day-to-day business operations, including supply chain, payroll, finance, accounting, workforce, and inventory management. We are upgrading the current Infor Enterprise Resource Planning system. This is a huge undertaking requiring considerable staff time and resources as our teams test system functionality and workflows in addition to their existing responsibilities. Operations should begin to feel improvements about a year. This really hit home to me, the ERP upgrade, when we're talking about the challenges around our DHE projects and our DHE staff are going through these manual reports, and we just can't get the villages the information they really deserve and need for their planning, and this is because we lack really a useful tool in the ERP. But this is gonna solve a lot of the problems, not just for DHE, but everything that I mentioned before. Other capital investments include sterile processing improvements, where we're making improvements to processing in 2 locations on campus, at the hospital and at the University Lake Medical Center. By improving our technology, processing time, and enhancing the quality of instruments, we will decrease losses and reduce overall costs of sterile processing. This is a behind-the-scenes patient care enhancement important to patient health and safety. The Da Vinci surgical robot is a tool to increase the scale and efficiency of minimally invasive surgeries, offering less invasive, less traumatic surgical procedures for patients. Adding a second robot increases access and decreases operating room times and aligns with best practices. We did our first case with the equipment this October. I didn't do it, but the appropriate surgeons did. I really want to thank the board for supporting our artificial intelligence and robotics. Our board is very forward thinking about these tools to improve care. Now let's talk about finances. For any organization, strong financial performance is key to putting the strategic plan to work. It allows us to align our operating margin with our mission. At ANTHC, a sustainable operating margin has challenged the organization for the past decade. We have historically relied on infrequent settlements to sustain operations, including the contract support cost settlement in FY14, Medicaid expansion in FY16, and the COVID relief in FY20 and 21. Over the past 2 fiscal years, we have focused on margin management to improve financial performance. Despite national headwinds and other challenges like rising costs and inflation, in FY24, ANTHC's financial performance was strong and continues to improve. The graph on this slide shows ANTHC's operating revenue and expenses. The dark blue bars show a steady increase in operating revenues from FY22 to FY23, with a more sizable increase in FY24. This is a lot of talking. Last year I asked for more mic time, but I jinxed myself because it's a lot. We achieve this through investments in our revenue cycle, enhancing clinical operations, and making appropriate cost reductions. Thank you. At the beginning of FY24, the ANTHC board approved a budget with a negative 2% operating margin. This allowed us to catch up on investments in IT, facilities, and clinical areas. Strong patient volumes, more efficient cost measures, and focused initiatives led to a fiscal year-end operating margin ahead of budget at 0.5%. Key aspects of revenue in FY24 included 11% growth in DHE, with some limitations due to national supply chain and limited engineering and construction resources in Alaska. A 13% growth in operations at the Alaska Native Medical Center due to increased volumes in specialty clinics and surgery, and expanded use of the 105L lease reimbursements, that IHS program that I was talking about earlier. The light blue bars show increases in operating expenses that align with the increased revenues and growth, including increased costs in labor, housing, travel, and supplies. Even with the increases in labor, we remain below national benchmarks at ANMC. Despite the overall increase in expenses, contract labor is down due to filling needed vacancies. The increases in expenses are expected to continue into FY25. As overall financial health has improved, ANTHC is meeting and sometimes exceeding national benchmarks. The graph on this slide shows our days cash on hand and days to collect patient revenue in accounts receivable, also referred to as AR days. The blue line in the graph shows the days patient revenue in accounts receivable. This tracks how long it takes from the date of service until patient charges are collected. The lower the number, the better we are performing. This shows steady improvement over the last 5 years. As of September 30th, our AR days were at 50.6, just a couple days higher than the national benchmark of 47.8 for the highest performing hospitals and health systems nationwide. The dark blue bar graph shows days cash on hand. This helps us measure how long ANTHC could fund operations if no more funding was to come in the door, excluding our grant-restricted funds for water and sewer. The higher the number, the better we're performing. This also shows steady improvement over the last 5 years. As of September 30th, we could fund operations for 11 months without additional cash. This exceeds national benchmark of 274 days for leading hospitals and health systems nationwide. Overall, total assets and revenues continued an upward trajectory, supported by investments in infrastructure and projects to support statewide services. Moving into FY25, ANTHC will continue to make necessary investments that support timely, high-quality services now into the future. These investments are balanced while achieving near-term financial goals that improve overall financial performance. This turnaround would not have been possible without the leadership of the ANTHC Board of Directors. They have prioritized investments in systems that help us to improve while also holding the organization accountable for strong performances. Like last year, we need your help with Medicaid and Denali Kid Care. Our patients are being directly contacted by the state to determine whether coverage will continue. This may mean updating or reapplying to keep coverage. Why should we care about this? The tribal health system receives less than 30% of the needed funding from the Indian Health Service to provide basic health services. Third-party insurance like Medicaid, Denali Kid Care, and private insurance like T-SHIP that Chair Strong mentioned provide dollars to help us build a better system of care. Medicaid beneficiaries are receiving notices in the mail. If you don't respond, unfortunately, you'll lose your coverage. If you or any of your family members receive one of these letters in the mail and need help filling it out, please take that letter with you to your clinic or tribal health organization and ask them to help you fill out that paperwork. There are several things you can do. You can scan the QR code on the screen now or update your contact information with the state of Alaska, check your mail for a renewal application, and complete and submit your renewal packet. Even if they say the submission date has already passed, still submit it. ANTHC also has a health benefits specialist available to help you screen and enroll patients in health coverage. They will screen for eligibility in Medicaid, Medicare, veterans benefits, and tribally sponsored health insurance program, T-SHIP. T-SHIP buys private health insurance coverage for IHS beneficiaries who qualify. Qualifications include Alaska residency, eligibility for IHS, and lack of coverage, current coverage, and lack of eligibility for the premium Medicare Part A. To reach a specialist, you can call 907-729-5696. For health benefits, email hbs@anthc.org, or for T-SHIP, email anthctship@anthc.org. We also have T-SHIP and health benefits specialists here today, and they're in the lobby in the health fair. If you need help, don't be shy. Please reach out. In closing, in 2025, we're going to have really hard conversations as a tribal health system. We're going to be resolving the medevac issues and how to balance needs and resources across the state. The EHR assessment is another really tough area that has a wide spectrum of needs and goals. We will navigate how to address necessary facility and program expansions, and we're going to address hospital ownership and other challenges brought forward at the Alaska Tribal Health Forum. At ANTHC, we're looking forward to these conversations. Even when we're having tough conversations, it's tough because we all love our patients, we all love our people, we all represent our people, our tribes, our regions, and our tribal leaders know how to navigate these difficult issues. We can find the right balance, meeting the needs of those from the Northwest to the Southeast and the Arctic, and we're moving into the next chapter of meeting the needs of our state. I recently went home and spent time with families in the communities in the interior. And going home is always a reminder of how cold Fairbanks is, but also how we're working and why we do the work that we do. What I was reminded is our people are really facing increased costs, and they're living paycheck to paycheck to make ends meet. And when we used to been able to rely on our subsistence resources, climate change is impacting that. The stark reality makes implementing our improvements so much more important because it's one less thing our loved ones have to worry about. When we meet the needs of our patients, it's one less burden that they carry. So with that, I'm going to open it up to questions. I think we'll start the poll again first. So once again, if you have an opportunity for you to take the poll, you have your cell phone, open a new text message, text ANTHC to 22333. You will receive confirmation that you have joined the poll. Numbers or letters will appear on the screen that you will use to send via this same text message to submit your answers to the poll. On the webinar, open a web browser and go to pollev.com/ANTHC. Okay, the first poll. The current strategic plan outlines 3 key themes: enhance the system of care, achieve performance excellence, and empower the workforce. What other themes are relevant to the health needs of our home region? Is the poll not working again?
It is working. So for those of you that used your phones earlier, you do not have to retext ANTHC, even though we love the shout out. So you can go ahead and text your responses to this question. You will be included in this live poll.
Okay, should we do the next question? Do you feel well informed on ANTHC's strategic plan, how ANTHC has measured its progress, and have information about ANTHC's overall improvement journey? Again, we have those scorecards that really measure our progress on the plan. They were in here earlier, but we had to move them to the lobby. That really helps get into the details of how management implements the board's strategic themes. I would like to recognize and thank Alaska House Speaker-elect Representative Bryce Edgman from Dillingham for being here, his first ANTHC annual meeting. Oh, there you go. Thank you so much for all you've done for the state of Alaska. Okay, well, 3/4 of the people are well informed of our strategic plan. There's room to grow, but that's good feedback that we're getting the message out. Next question, please. In the coming year, the board will begin work on the next strategic plan. In your perspective, what 3 areas are most important for the strategic plan to focus on? Select 3 options: expanding patient care, A, B, availability of services on the Alaska Native Health campus, C, availability of service through field clinics in regions, D, facility investments, E, improving access to care, and F, cultural relevance of services. Oh, that's a hard one to just pick 3.
Natasha?
And I can guarantee you that we are working for all of these priorities, though we do have a priority system because we can't get to them all immediately.
For those on your phone, please enter your first choice, hit enter, then do your next choice. You have up to 3 options while you're ranking these, but you do have to hit enter after every choice.
Looks like improving access to care, expanding patient care, which to me is the same, and availability of services on the Alaska Native Health campus are getting the highest. So I think our plans to expand and invest in our facilities are really in line with the feedback we're getting today, which is great news. Thank you for, let's move on to the next question. If you could add one focus area that is not listed previously, what would it be? Is this an open-ended question? If you could add one focus area not listed previously, what would it be? Behavioral health. Thank you for that. I know Peter Williams from Anaktuvik made that comment earlier today. And just so you know, on our FY25 scorecard, our board has placed creating a behavioral health plan. And we continue to understand the shortcomings with behavioral health across the nation and the state. And together as a health system, we really came together to talk about that at the forum. And we need to create a plan on how we plan to address behavioral health. Traditional medicine. I know South Central Foundation is doing a lot with traditional healing. Thank you for their services on campus in that area. Public health and prevention. A lot of behavioral health requests. As Native people, we care so much for our families, and when our loved ones are struggling and it's difficult for them to access the care when they want it, it's really heartbreaking as tribal health leaders, as family members, and it's something as a system that we're going to have to come together to address. A lot of behavioral health feedback. Move on. Okay, thank you. We are going to be taking this feedback from you all and taking it to the board as we plan our next strategic plan. Next question, what is the most effective way to share updates with you? Mailed newsletters, website, events like the annual meeting, social media, community bulletin, through my regional health organization. All right, you like the annual meeting? It's going good so far. We did the forum in October, and we had more like specific issues that we are addressing. But I agree, I love meetings, so I think they're a way to best way to communicate. I must be in the older part of the crowd since I don't vote for social media. Next question. Do we have another question? One more. What is the best way to engage with you and other leaders in your region to set ANTHC's strategic priorities? A, through your representative on the ANTHC board. B, consultation with your tribe. C, coordinate with leaders from your regional tribal health organization. D, send direct surveys. Or E, annual meeting feedback survey sessions. All these are all just the ways. Please get us feedback all of these ways. They're all so important in the current ways that we're able to shape our future. So at this time, we're gonna allow for any questions from the audience. If you have any questions about our plans, our strategic plan, or anything that we mentioned. I'd like to thank April Kyle, President of South Central Foundation, for being here as well. South Central Foundation, our campus partners. Come on, throw me a hard question. No? We're good? Wrap it up? Okay, since I answered all of your questions in my amazing presentation, we are going to play the video.
We have one question on this side of the room.
Oh, I can't see from the blinding lights.
Yeah, Peter Williams. Anyway, I just wanted to say that, we need more attention on consultation to your ANTHC, because, it's very important to us because it's the only place that we could get to. And then now that, we're having a problem with cancers and all this addictions going on, and we need better communication with ANTHC. Now that we're on the table here, I like that annual meeting keep going. Another thing is that our people is suffering from what's going on, and they had to wait down here in Anchorage for a month sometimes to get an appointment, and they'd be held back because they're not a tribe member for Surrey and Sea Alaska. So let's get this better understanding for our tribe to work together. Thank you.
Thank you. We'll continue our consultation efforts with the tribes and our communication with the Alaska Native Medical Center. Yes, there's a question in the front.
Maybe this is a difficult question for you, but I'm Andrea Cadiente-Lighty from the Douglas Indian Association, Tribal Administrator. And the question I have for you is, why are you the interim president/CEO?
Thank you. The ANTHC board is recruiting for a more permanent president and CEO. They've hired a national recruitment firm, Spencer Stewart, actually international, and the position has been posted. I've heard they have dozens of applicants, and they're going to start interviews in January, and hopefully we'll have a selection of the president and CEO by late February or March.
This is the first time I've attended one of your annual meetings to find out more about just how vital ANTHC's role is. For those who haven't heard, this is the first meeting that Douglas Indian Association has attended, so thank you for that. But as you know, with most tribes, we look to our own people to lead. And I just wanted to commend you for doing a very fine job today for laying out the information. I've learned a great deal about what ANTHC is all about. We could only surmise pretty much in the past without tribal consultation directly. So thank you for that.
Thank you so much for that feedback. Okay, no more questions.